My name is James Browne. I'm an orthopedic surgeon. I specialize in hip and knee arthroplasty. We do both first-time joint replacement, where we take a patient who has an arthritic hip joint or an arthritic knee joint and replace it. We also do a lot of redo surgeries or revision surgeries here at UVA. I think there's a lot of advantages to having your joint replaced at UVA. First of all of our surgeons are really specialized. This is what we do. We're true specialists in joint replacement and hip and knee replacement. It means we have a lot of experience. We're on the cutting edge with innovative technologies, and we have the team approach where everybody on our team is specialized for this one thing that we do. And that really impacts outcomes. There's no question about that when you have a dedicated team like we do here at UVA who specializes in this procedure, you're much more likely to have a good outcome. We see new patients in clinic. We examine your condition. We look at different options, and surgery isn't always the option, so we're careful to review non-operative treatments as well. For those patients who have clear indications for surgery, who we think will really benefit from the operation that we do, we then have a whole process that we take patients through to get them ready for the operating room. I'm really passionate about helping patients get back to their function. That's really what we do in joint replacement, is we improve pain, we relieve pain through surgery, we also allow patients to regain their function. So seeing older patients in particular who are starting to lose some independence and starting to lose some quality of life, and being able to impact that in a relatively short period of time through a joint replacement is incredibly rewarding.